My name is Lauren Bergstrom. I am Associate Director for Hospital Imaging, and I have my doctorate in nursing. And so I am going to talk to you about reducing burnout and enhancing engagement. I know she talked about a lot of QR codes, right? So I use QR codes during this presentation as well. If it's not populating appropriate up here to show the results as I go, have no fear, I will show you on my computer, but you're going to have to bear with me as I switch back and forth so I can show it. I have the QR code right here on an iPad, so you can scan it when it's time, because we'll be live polling during the class. So second course, we're going to be in here a while, right? So learning objectives here. So after attending the CE unit, you're going to be able to identify the value of identifying primary indicators of burnout, review and apply proven assessment tools, and apply evidence-based leader standard work initiatives. This is something near and dear to my heart. I find a lot of the time we focus on burnout on our teams, and we forget about our leaders that are leading those teams. We say, okay, we're going to help the people below us, but then we forget that the people that are leading need the help as well. And so that is why I talk a lot about this in my work. So again, my name is Lauren Bergstrom, Doctorate of Nursing Practice, and I'm Associate Director at OSU Wexner Medical Center. I am over all of inpatient imaging services. I served as our interim director for about 7 months, and so work very closely with our director as well. And so implementing all of these work initiatives would not be possible without my teams and all of the leaders that work around me. And so without their engagement, without their focus on this, without constant refocus on leader work-life balance, we wouldn't be where we are today. Additionally, we do have executive leader support, and so I just wanted to call that out. That has been wonderful coming from the top down in our organization. So this is just saying I have nothing to disclose here for financial relationships or commercial interests. So a little bit about OSU Wexner Medical Center. We do have 7 hospitals. I am over the inpatient services, and so I do cover 3 of our hospitals and also additionally have a footprint in an ambulatory setting. There are 1,400 staff beds in our hospital. You can see there are other details here. It's just important to call out we are a large academic medical center. A little bit more about us here. So we're nationally ranked for 31 consecutive years by the US News and World Report. You can see some of our other stats down there. We are a magnet recognized hospital as well. This is really exciting for us and also really nerve-wracking. I think we see this building and we're very excited. It looks like this now, almost completely done. The inside's not there yet, but we will be opening in a year from now. And so as you can imagine, everything has focused to that new tower. So I'm sorry. And so it's really been hard. As I talk about work-life balance, we recognize that the next year is going to be a strain on all of our leaders and our teams for balance. And we'll get there, but it's going to be difficult. 820 large private rooms. It'll be about an additional 500 beds for us because we will be closing a few in our current footprint right now. For the agenda today, we're going to walk through introductions and organizational overview, primary indicators of burnout, selecting the right tool for evaluation, improving resilience and increasing team engagement, our outcomes, our insights, and our future plans. So primary indicators of burnout. This is where I find out if this slide is going to connect or not. So if you could scan the QR code either up there or additionally on the screen in 1 second. Told me to accept all, so it's not going to load for me, guys. That's all right.
Oh, okay. You didn't need the side of your face, did you?
Oh, no. You can scan right here too. This should work too. Sorry to make you get up and move around, guys. So the question here is, have you experienced burnout? I will show you the slides right here so you can also see it. Right now I have 12 yeses and 2 no's. So 2 of you have not felt burnout yet, and either you're new in your role or you're phenomenal at what you do, and I need to connect with you because I am not there, okay? I know, right? Please come talk with me because I am not there. I am burnout. I know something's going on really good here, and so I'm not saying that to shame anyone. Yeah. This This isn't going to show up here live, but that's okay. I'll be able to show you right here. So we do have 16 yeses and 2 nos. I believe almost everybody has put it in here. Again, I joke about the no, you haven't experienced burnout, but if you have not, that is amazing. And I really would love to learn from you because I am doing my best here. And as a doctor at nursing, I'm extremely focused on whole life wellness and balance. And so that is key to me. And so I really would love to connect with you. Okay, I'm going to move on here. So what is the definition of burnout? I asked you that question before I gave you a definition, kind of on purpose. I really wanted to see what you felt, you were experiencing for burnout. And this is one of the actual definitions here. I do cite my references in the slides later. But burnout's an occupational syndrome characterized by a high degree of emotional exhaustion and depersonalization, so cynicism, and a low sense of personal accomplishment at work. So it's also known as emotional and cognitive distancing. It's not the words we use often. We go to just saying burnout, so it can encapsulate a lot. And it is chronic work-related stress is a precursor to burnout. So if you see somebody who is extremely stressed at work and withdrawn or having issues, you can see that they are potentially approaching burnout. Oh, these slides are not working, guys. Every time I click a button, it's going like 5 in. There we go. Burnout can be defined as an erosion of engagement with the job, whereby energy turns into exhaustion, involvement turns into cynicism, and efficacy turns into ineffectiveness. I love this because this is exactly what happens. We see this when somebody is burnout or somebody is withdrawing from their job or somebody is very dissatisfied. So the same slide, the same QR code should work. I'm going to advance to the next here and you'll be able to see the next question. Can everybody see how has emotional and cognitive distancing showed up in your workplace on your phone? You don't have to scan a new QR code. It should be the same one if you just pull up that same site you were on. Not working? Okay. I'm sorry, when I present these at work, it's linked, right? And so it works the whole time. And so it's a little bit harder when you're presenting live here. As some of the answers are coming in, we have lack of focus and easy to busy work your work doesn't feel like an accomplishment. Poor communication, so leaders staying silent and less supportive, the give up attitude. Yeah, we've seen that before, right? Displeasure, decreased morale, exhaustion, low energy, complacency with doing the bare minimum. That's also another very true thing that we see. What'd you say?
I cleaned off the top of my desk.
I am proud of you. Yeah, that was the bare minimum for you. But sometimes maybe that's how you can show up that day and that's it.
Yeah, that's all you get.
Okay, maybe that's your 100%.
I wore shoes today.
Same.
I wore pants today.
There you go, done.
Pants today.
Done. So also high turnover rates, that's a big one too. Sick calls or increased skirmishness among staff and decreased productivity. And so people at each other's throats. Ooh, that's a real one. Decreased morale, work attitude forced into old workplace, lack of interest. So it just keeps going. These are all very similar to what our teams have talked about, what we have shown, what we have seen. And so I wish I could be showing it live right now, I'm sorry. But those are all ways that emotional and cognitive distancing shows up in your workplace. And we're all speaking the same language here of what burnout is for us and our teams. And so the importance of evaluation, we can talk about burnout all day long, but unless you can evaluate what is actually going on with your team, how do you improve it? We just kind of throw spaghetti at a wall and hope it sticks, try and do something different, but we want to evaluate what is actually going on with our teams and how they are burnout. And so there's decreased time spent between the provider and the patient. And so that's when you look at burnout with the teams, you see that there is decreased time and attention to the work. It's important to evaluate because you have increased medical errors. There's increased hospital-acquired infections. There's staffing shortages. We can go into so many different reasons why you should actually assess the burnout within your teams. And so evaluating the burnout indicators. So chronic work stress is associated with poor physical and mental health outcomes. And you know this, we know this. We've seen this within our teams. We've seen this within our leaders. You can see the illness, people recover slower when they are burnout, when they have stress and high stress environments. We know what it actually physiologically does to your body. The scary part here is you start to isolate yourself, and it's linked to a lot of mental health problems. There's an increased risk for substance use and misuse. And so as you look at all of these reasons, these problems that can happen, these are all reasons why you should be focusing on burnout with your team, but also with your leaders. And that is the piece we miss, is focusing on it with our leaders. I'm sorry. And so a burnout example in our workplace. This is really key to me because we started talking about burnout with our director, and I'm an associate director. I had stepped into my director's role for about 7 months. That's key here because I recognized my director was burnout and she got very sick. And so I'm very allowed to share this information. She is one that shared with our teams too. When she came back to her role after being out and getting treatment for cancer, she started talking about how she was feeling prior to going out, and she was not okay. And so she came back and I'm like, listen, we have to focus on our teams and our burnout because I'm not okay right now. I was only 7 months in. She'd been doing it for 2 years, 2.5 years at that time. And we were not able to connect with our teams in the way we should. We couldn't show up the way we wanted to because we were so pulled in so many different directions. I recognized what my director did, but when I stepped into it, I had a new appreciation for what she did, and I couldn't manage it. I have kids at home and a husband and a farm, and I could not do any of the work that I had at home. And so started talking to her about how do we talk to our teams? Because if I'm feeling this, I know every one of my leaders is feeling this. And then how does that show up within their teams below them? And so we actually had a very large meeting with every single one of our leaders. We sat in a circle that day and we talked about our feelings, but really we talked about burnout and connection. And so why it was so key for you to be connected with your teams and those around you so that you didn't have the burnout or feel the burnout, or you knew you weren't alone as you were working through some of the issues and feeling pulled in so many different directions. We also really engaged with our team at that time. And so we shared our stories. I shared losing my connection with my teams because what happens to me when I get extremely stressed is I withdraw. And so I was at the point where I wasn't supporting my leaders the way they needed to be supported because I was so focused on the tasks. And I'm not I am task oriented, but I'm not tasks first, I'm people first. And so then it caused this tear in who I am and who I am as a leader of I'm not giving my team what they need. I'm not focusing on the people, and instead I'm just focusing on the work. So I lost my connection piece. She shared her story about what happened with her and getting sick and how she thinks it what some of the contribution was that she was so stretched thin, not able to focus on her well-being. How long did she put off her doctor's appointments because of the stress at work? And then we had our leaders share. And so this was huge. 2 of the leaders spoke. One of the leaders that reports to me when I came into my role 2 years ago was working on the floor 24/7, was not able to get her tasks done at work. So she was putting in all of the time at home. So she's doing her 40-hour job at work, 40-hour job at home. She has a child and she was also in school. And so I walked into leading her, and she is a phenomenal leader, but there was no balance. She was not able to get her job done at work. And so we started talking about that structure and what it looks like and pulling her back. She cares so much about the people below her that she felt it was a disservice. And so started talking about that, put the oxygen on yourself before you put it on other people, right? Flight attendants, you probably all flew here. Put the oxygen on yourself so that you can care for others. So we all shared. We shared and talked about what we wanted it to look like as we move forward and how we would assess what our teams, what our leaders were experiencing, and how we would implement changes that would actually impact their day-to-day. And so we chose the right tool to evaluate our team. A key organizational strategy to improving clinician well-being is to measure it, develop it, and implement interventions, and then remeasure. So that's that PDSA cycle, right? You're gonna see what's going on. You're going to plan for it. You're going to do. You're going to study, and then you're going to act, and then you're going to do it all again because it's a cycle. So right now we've evaluated twice now. This will be our 3rd evaluation coming up, and I can tell you, I know we are all more burnout than we were the last time because it's budget season, and so we're all really stretched thin. And so, what resources do we need? But this quote just is really key. This clicker does not work, guys. I'm not joking. You can hit it once and it goes like 5 ahead. Might need a new battery. Wow. Okay. I'm gonna try one more time. Okay, so why assess burnout? The benefits here of assessment. I'm so sorry. Identification of areas for improvement and intervention, invest into your team's well-being, supporting that culture, early intervention, resiliency, improving the patient care, because if you're caring for your leaders, you're caring for the teams. I know it doesn't feel like it sometimes, but you are, because you impact everything they do and it trickles down. Improving quality of patient care is on there then, and then enhanced productivity. Absenteeism is huge on here, and then job satisfaction. I'm really scared to press a button here. So I wonder if this is going to link now. Let me get the next question pulled up here. Give it 1 second to refresh. Should be refreshing right now. What burnout tools, if any, have you used in your workplace? Is that one coming up for you all?
No, I'm back to the first question.
Give it a second. I'm so sorry, guys.
Yeah.
Just tell me if it starts to work. It's okay.
I'm back on the first question.
Okay, give it a second. It's
Good question.
probably slow linking is my
What burnout
guess.
assessment tools? Yeah, it's there. Okay.
Working?
Yes.
This clicker is broken, yes. It's fine. I just keep clicking like 8 slides ahead. I'm trying to get to the end. I know, we do. We should play it. Somebody want to go?
I'll just get you.
That's fine.
Burnout for 500.
Yeah, burnout for 500? No, that's perfect. Thank you. I don't mind at all. Thank you. Every time you click it, it would go down like 5 slides, so I'm fine. I see some answers coming in here. I'm gonna let it keep going for a minute. I'm glad I can kind of talk on the fly, so. Just trying to go there. I'm gonna go that way. All right. A few more answers coming in here.
I don't know where you were at.
That's no fun. There we go. Okay, so what burnout tools? Thank you so much. Have you used in your workplace? Select all that applies here. So we have 7 people that no tools have been used, 8 for an individual survey, which is good too. 3 for a valid and reliable tool. So 3 of you are using tools that are out there that have been tested and studied to assess and improve your burnout in your teams. And then 4 for an internal organizational assessment. So we do that as well. And so we have both results that we use and look at to assess how the team is feeling with being stretched too thin. Something huge here though is that 7 no tools have been used. So think about that. So it's not been assessed in your organization. And so questions related to then, do your teams feel burnout, or are these the people that don't have any burnout? And so that's also key too. And so it's something to just think about. We don't normally assess this. We especially don't assess it in our leaders. So overview of assessment tools. There are various tools available to measure burnout, engagement, professional satisfaction, stress, fatigue, quality of life. If you look in the different tools that are out there, you will have numerous different options to choose from. I'm going to go through the top 4 assessment tools. I will not read all of this on the slide to you, but there are 4 that are very, very well known. And so the first one there is a human services survey for medical personnel only that is really a 22 item that covers all of that up there. We didn't choose this one, and the reason I didn't choose this one is because it is focused on the bedside work that you do, and I wanted to focus on leaders. There's not really a survey that's valid and reliable for just leaders. However, we did choose the Oldenburg Burnout Inventory. So the reason we chose this one is it covers exhaustion and disengagement, and I thought, okay, that's leaders. We need to know how engaged they really are. They impact every part of the teams. There's also a single item burnout measure. It is a single question. And so it's overall, based on your definition of burnout, how would you rate your level of burnout? It's a valid and reliable tool that's been tested and has wonderful information out there as well to use. And then the Copenhagen as well. And so this is positively and negatively framed items, and it covers various different domains as well. I only picked 4 to look at because there are a lot. And so each tool has advantages and disadvantages, and you should pick the most appropriate one for your setting and your teams. Prior to administering the survey, you do need organizational support. And so any of the changes we have made, if we did not have senior level, executive level support in this, if he was not working with us to say what you would do and be able to do with your teams, then you would not be able to succeed. And so making sure that if you're going to start assessing your burnout within your teams and assessing how your teams are performing, that you have support. And so again, we chose the Oldenburg Burnout Inventory. The reason we chose it is it is a self-reported measure of burnout, measures exhaustion and disengagement, includes positively and negatively framed items, and it's a reliable and valid measure of burnout. It can be used to track changes in burnout over time. That was key to me because I wanted to keep evaluating. Where are we at? Give me a moment in time. Twice a year is what we're looking at. And so these are the 16 questions. You can find all this information online. It is an open tool that is free to use. And so anybody can use it at any time. You're supposed to cite it if you do. We did do that. And so these are the questions that you ask. Something big on here is I can tolerate the pressure of my work very well. And it goes into lately. I tend to think less at work and do my job mechanically. So that's what I experience. I know they're good. Over time, one can become disconnected from this type of work. After working, I have enough energy for your leisure activities. How many of you get to do your leisure activities? Does anybody know what leisure is? Because I'm missing what that word is, I think. Oh, there you go. That's my leisure. Napping, done. Are you napping? Are you napping at your desk? This is the only type of work I can imagine myself doing. So that's a positive question to say, is this what you're wanting to do essentially? I feel more and more engaged in my work. When I work, I feel energized. So you have positive and negative framed here. And so it makes it easy to evaluate both. So that was the tool we chose, and we did it because we want to create a more resilient and engaged leadership team. This poll, if you just go back in, you don't even have to click that, should be open. I just opened it before going to the slide. Let's see if it works. And it's how do you feel you can counteract burnout in the workplace? And that is a 1 to 2 word shorter answer.
Already responded.
You can go back if it doesn't. Yeah. I have some good words coming in. So I'm creating a word cloud from this. I will keep the information on here so that I can reference it later. This word cloud's really good. So far I have vacation. That's the biggest one on there, which is so true. Meditation. Okay, somebody put quit. I mean, sometimes that does help, right? It depends. Maybe that's not the job for you. I'm not mad at that. New boss. That's a big one. So what is it? I mean, that's big. So what is it about your leader that is not showing up in a way that you need? And how do you express that then? Time off, job enrichment. What does that look like? I want to know some of that. Boundaries. That's a huge one. There's a book called Boundaries. There's different iterations of it that really helps you with creating boundaries for yourself. Working from home, blocking focus time, PTO without a guilt trip. That's a good one too. I mean, think about it. No, yeah, these are all real. What I love about this is the honesty. Every one of you are leaders of something in your organization. And so hiring new employees, listening, prayer is on here, communication, family support. Ballroom. Does somebody do ballroom dancing? Because I'm jealous. I love that. If that's what gives you joy to help like with counteracting burnout, that's what you should do. For me, I color. So I mean, I draw.
I can't think about, we all have jobs where we are so thinking about 1,000 things at once constantly, even in the shower. But in the ballroom, when I'm training, I can't think about
anything else.
FTEs and schedules and who's called off and how do I cover the shift and my budget and stupid other dumbass video meeting that we have to have that could have been an email, should have been an email, or just send me a memo. If I'm thinking about frame, where's my head? Is this a heel lead, a toe lead? Is this, you know, what kind
I
of
love that
dances
you
is-
have something that gives you that joy.
If I have that much I have to think about in that moment, everything else gets pushed out of my head.
That's
and it
perfect.
actually makes me relax because my brain doesn't shut up.
So I think that goes into your meditation then. Somebody else
Mhm.
put meditate on here, and that's her meditation. I think that's
I
wonderful.
just do it
Awareness. Awareness is on here as well. Listening is on here. Educational resources, that's huge. Security is on here. Taking breaks, I like that too. If you'll notice though, our biggest is vacation and support. And so those are the two things that come up as the largest, somebody put that information in the most times. And so vacation and support. And so our team's response. Yeah, exactly, Maslow's hierarchy. And so this is our team's response here. The best part of our leader's job, that's the question we asked, one of the first questions we asked. And they said interaction, relationships, growth, the team, people, teamwork, staff, collaboration, all of our teams. This is what our leaders said and what it represents as the best part of their job. We wanted to focus on the positive first before we started talking about the really difficult things. And so balance. Something they came up with, our team came up with, is saying no to some things so you can say yes to other things. And this was our Associate Director of Quality. That was the words she used to describe how you say no, because our team does not know how to say no. I think all of our technologists care about that next patient so much. So stepping into a leadership as a technologist, they still care about that patient and also their teams and the patients below them and everybody. And so they have difficulty saying no. And that was what my manager, who was extremely burnout, she said, I just couldn't say no. And so it was, okay, how do you say no by saying yes to something else? Or it's I can't do that right now, but I can. Or it's another way to frame it and say, I'm not saying no. What I'm saying is to do this and make it successful, I need these resources. And so we helped frame some words that they would use. So we desire to be available always, but it's not possible. That was really big in what our team said, and that's very true. And so connection, we talked about balance and connection in our group session here. And so what gives us endurance to keep going? And they really called out that this is different for everyone. And so some people don't like to be connected as much, and that's okay. But if you are somebody that needs to stay connected closely with your teams, how do you make sure you don't lose that connection then? And so we point out Maslow's hierarchy of needs here. And so if you can see belonging, that's where connection pulls in. And so how are you just making sure that you are taking care of yourself so you can take care of others? This session is one of the sessions talking with our teams that I still look back on those notes and I think, wow, I'm very impressed with what they had to say, with how they influence each other and how they show up to their work, and also how they're willing to learn new ways of coping and dealing with their burnout or balance. And so leader standard work. This is where we come into some of the tools we use as a leader. And so Lean Six Sigma pulls in a lot of leader standard work, right? But this can show up in different ways as leader standard work being a set of reoccurrent management tools and techniques and skills that are standardized in your daily and weekly routines. It feels exhausting when you think about leader standard work sometimes, like how do I set this up? It takes some time. But once you start getting standard work that you do, then you can stay with that. Make sure you stay on top of what you need and then focus on the other pieces as well. And so there are leader standard work initiatives. They can improve your work-life balance by promoting structured routines and practices that foster a healthy work environment. Two of my leaders, one of their leader standard work initiatives is that they take lunch at the exact same time every day. They decline meetings to do it. Now, if something's on fire, of course, they're going to run to the fire. But for the most part, they hit about 95% of their time taking their lunch at the exact same time in the exact same place. And it gives them a disconnect. And they also take it together so that they can talk to each other, not about work. That's their rule. They sit down at the table. They don't get to discuss work. They do it 30 minutes every day. I admire that because I eat lunch at my desk. So I know I can talk about this all day and say, this is what we should do. And sometimes I struggle with it because you have to refocus on what is important to you. So maybe that lunch isn't as important to me, but I do a 10-minute walk in the morning. And so just getting in the hospital and walking, just getting outside and walking, whatever I can do to move my body and make me re-energize. So however you look at leader standard work, you're thinking about what works for you and what can help you stay structured and take care of yourself and others. Some examples up here are visual management tools, daily checks, tiered meeting structures. That's something we assessed and reevaluated and eliminated with some of our meetings. Audits and reoccurrent inspections, something else we assessed and eliminated were a large amount of audits because truly, I'm a nurse and so we use a lot of audits in nursing as well. What are you doing with that audit tool? because if you're not doing anything to make a change, then that's a waste of time. And so we reevaluated that, and then training and procedures as well. And so some of the ways we created resilient leadership teams is looking at our resiliency engagement. And so fostering connection with our teams, again, going to that balance and connection. Our team is so focused on how they stay connected to each other, their teams, those around them. Now, that comes with you need to have boundaries. And so it is not 24/7 connection. It is a connection that works for you and others. Again, we go back to everybody is different. And so finding out what works for you. Striving for balance. I can't tell you what balance looks like for you. You can only say that. And so evaluating how you balance what your priorities are. For me, my priorities are my children, and they will always be my kids. And so I am also focused on work. I'm very driven. I love what I do. I love my teams, but my teams know that I eat dinner with my kids in the evening. That's it. I don't want to be interrupted during dinner. If they do interrupt me, that is okay. It is usually an emergency. I have a leader who they like to play a board game, and there's a game that they play with others. They don't want interrupted during that time. That's okay with me. Just tell me when. We keep a calendar updated to say what we do. I have another leader who does marathons, and she's like, when I'm training, I can't be interrupted for this. And I'm like, okay, like that's important to you. That's what your big important thing is to focus on. You tell me and I'll help you. Again, we work at a hospital 24/7, so you need to have somebody back up, right? If you can't get there, or also make sure you, in case of a fire emergency, I always say fire, but make sure you can still be there. So we implemented wellness programs as well. You provide the right resources, and then transparent communication is key here too. So it's talking about what you see in others, not just ignoring. So it's not just, how are you doing today? Good, and you walk away. Like, actually, how are they showing up to work? How do they appear? How do they feel talking to each other? All right, next question here is, how well is work-life balance prioritized in your workplace? It's very similar to the other question, but looking at it from a department level, an organizational level, your team, and also how you prioritize it. And if it doesn't work, tell me.
Can I recommend a question
Of course, I would love to hear that.
to add on to this?
I won't be able to add it on right now, but I will
Right.
add it
How
on.
does your boss feel about your work-life balance?
How does the leader above you?
Yeah, my leader above me thinks I have no work-life balance, so I work 24/7.
I remember you mentioned that.
But I look at my life and go, I have a lot of work-life balance. I train
get to do your
ballroom
ballroom dancing,
regularly.
yeah.
I play D&D twice a week.
I like D&D as well. I love it. Okay, I'll let you keep answering some questions here.
But that,
Yeah, I like that question. I will add that in. I like it. I think it's good. This is looking really good. I have it on a sliding scale here, and so I'll share the results in a few moments. I do feel like Vanna White over here. Do you want to get a picture of this, Ashley? I'm kidding completely. I'm going to tease myself, right? That's going to be really good. It's good. Yep, there you go. It's not going to work. It's fine. Okay, so looking at this, I prioritize my work-life balance. And so that's at a 3.6 on that Likert scale there. My team prioritized work-life balance. So this one is very divided. I have a lot of ones, and then I have a few fours. And so this one is not going to give me a good answer because it completely divided. And so it's not going to give me an average. It's going to say those are outliers because there is no. Yeah, tell me.
I think that question depends on how you're reading it, because we talk about my team that reports to me, or we talking about my team that works with me.
Ooh, excellent call out. And then the next one.
being a team.
It should be the team below. Yeah, there you go. I like that. I wrote that down so I can put that in there too. Thank you. And then we have my department prioritizes work-life balance. So overall is at a 3.1. And then my organization is at a 2.6. And so what this is showing here is that you prioritize it in your life. Your team, yes and no, prioritizes, depending on which team maybe. Your department prioritizes very similar to how you do, but your organization does not. And so how do you implement changes to focus on your prioritization if you don't have support from your organization? I don't know how you do. And so that comes into play as how do we then lead up into the executive level above to say, this is important. I really admire the generation that is coming into the workplace now. It's frustrating, but also they demand balance and connection. And so that can help us as we are trying to get a sort of semblance of balance and connection for our teams.
It's definitely going to change the culture.
It is.
4 years.
I was about to say, doesn't that has to do with the culture?
Yeah.
Because a lot of times the culture, I don't want to say it's toxic, but it is just like
Not
the
supportive.
bottom line, you lose everything because now
Yeah.
you're driving your people.
Yeah.
And some departments, like I know where I work at, they say we're supposed to have 25, we have 12.
Yeah. And so it
But
makes it
still expect
impossible.
Us to be at this level,
Mhm.
and everyone just fires bullets and then you're stuck.
Yep.
Trying to figure out a way how to get away from it. And then when you tell them, they kind of look at you like, oh, that's your job.
Yeah. Yeah. It's hard. Go ahead.
There's also such a broad range of ages,
Yes.
and those of us who've been in it, I don't know, 30 years, we're thinking, you need to pay your dues.
And that's a hard thought. I hear that. I have a team that is smaller, and one is very, very experienced and the other is very new. And so very young, very green. And so the younger one wants 4 10s and wants to work 4 10s, and the other one works 5 8s. I had to work 5 8s is what she said. I also had to start on night shift. She has to do that. And I'm like, hold on, I want to challenge you on that thought, because just because you went through something that was really hard, why don't you use that to pivot and change it for the team below you? So I'm a nurse, and so nurses eat their young. Has anybody heard that? Okay, right? Somebody tried to eat me. It was bad. They wanted to devour me and make me quit nursing, I think. So I did not quit nursing. But what was really big with this is with the nurse eat their young, it was because they went through fire in their experience. They worked night shift. They were treated poorly. They were told what to do. And I use this example because I almost quit nursing then. They should have quit at that point. I mean, I don't know that they should have stayed with how they were treated. And so had a big heart to heart of why would you want for me what you experienced? And so why would I want for the people below me what I've experienced? Why wouldn't I instead pivot, use that as my, hill to stand on and say, I'm going to shape the group below me instead of I'm going to make them experience what I did. It's a hard thought to switch.
It's like saying, I got assaulted by a patient, so you should have to as well.
Well,
I got into a car accident this week, so everybody else around me needs to get a car accident.
It's a very controversial.
It also has to do with, you don't understand me.
Yeah, you haven't lived my life,
You
you
haven't
don't get
lived
it.
my life. You haven't had the experience, you don't understand.
Yeah. It's really good. It's really good when we are open about those feelings, right? So my very experienced leader, I asked her to share with the younger, like why she was feeling that way. And the younger generation has to show the respect for it, but say that I'm not okay with it, right? So one more, and then I'm going to move on. Go ahead.
I think you're kind of about mentor.
Yeah.
If we don't have mentors,
Yeah.
then it goes away.
It's funny that you mention it because we did mentoring as well through
Yeah,
here.
because I'm mentored
Yeah.
a lot. Because I never had it.
Yeah. So you want to change it for people below you.
I try to mentor them, show them what they need to do.
Yeah.
And I kind of tell them, you're going to be a leader. And they're looking at me like, what?
Yeah, I love that we're all thinking about this so much because, and I also really like an interactive audience here because this really tells me that this is important to you and it shows up in your workplace in so many ways. And so, okay, I'm going to move us on for a minute, okay? So our call to action, what we did to do balance, to improve our balance and connection. And so intentional positive verbiage, this is huge, and I struggle with this to this day. And so it's how rested are you? You're showing up with a positive instead of like, you look tired. It's how rested are you? Because you look tired. Oh, look, I have a spelling error. What was the best part of your day? So that's all right. The best part of my day is I had a spelling error on here, and I don't care because it's okay. We're human. I love that we started talking about like what techniques have you used? What are you doing to give you energy? What brings you joy? We started a deep focus time in our department, and so that was giving people work from home, leaders work from home 1 day a week, and that was your deep focus time, as in try not to schedule meetings for a block of that time. Try to focus on something that gives you joy and learning in your organization, department, whatever you are focused on. So for me, presenting at conferences, talking about what's, what I'm passionate about, I might be studying some of that. That is where I use my deep focus time. Or it might be understanding budgets, and other leaders, I need to understand the budget better. And so they use that time to deep focus and not get interrupted. And so we invested in our leaders. You can see we did peer-to-peer accountability, quarterly retreats. So we scheduled these, canceled twice, and that was hard. And so we are going to get back to these. Leadership book clubs, these are still ongoing, and actually one of the best parts of my every 3 months. Even if we have to shift it to accommodate other things in our organization or other priorities, we still make sure we talk about the book we're reading. And their books on, one was Wolfpack, and talking about you become a Wolfpack with your team. And another was, I can't remember the name of it, but they're just phenomenal books that we focus on and pick together. And so different departments have different book clubs going on. We initiated leadership learning meetings. And so we just had another one of these, I think it was last week. And so in these meetings, we're focusing on how to teach your leaders to show up, how to support, what problems you encounter, just various topics. We provided additional resources. And so those resources looked like different books, looked like articles to read, videos, how did they learn? Make sure we had it so that they could learn it in different ways. And so part of our leader standard work initiatives that we implemented, so flexible work schedules, which is very hard for a lot of people to even think about. We had support from executive leadership to do this. And so he was very adamant that you should be flexing to meet the needs of your team. And so now we can't go around our whole hospital and say we're not working, because we are working. But we needed to just make sure we said what we were working on at that time. And so if we're working from home a day a week, it is, how are you using that time? How is your deep focus time scheduled? And so that's accountability from our leaders peer-to-peer, but then also we have a calendar we use, calendar alignment. So creating a standard calendar that showed you what was upcoming in the upcoming months, year, et cetera. So you could look at a year ahead. That we are working on redoing right now to show it a different way. Project standardization. This was huge, because how many times do you spend an extra 20 minutes trying to figure out which template to use, or which report you're going to utilize, or how you're going to put it into this format for someone? And so standardization. The deep focus time I talked about, blocking your monthly time for EBP learning, reduction in meeting frequency. So this was evaluating all of our meetings that were at the leader level and saying what is value added. It's EBP. Evidence-based practice. I'm so sorry. I should have wrote that out there. And so the reduction in meeting frequency was huge, because if you look at every person in a room, it is a lot of money to pay somebody, and especially if you're just giving a report out that you could read via slides. So we evaluated a lot of that. Some of our report out structure we needed still, so that our leaders could learn how to do report outs though. And so that was put into there. We also set boundaries for communication that looks different for everyone, and encourage scheduled lunch breaks. And so the results. You can see there, October 23 is when we evaluated disengagement and exhaustion. And then our overall score is, this is on the left side going down, is anything over 35 is at a very high risk of burnout. We were at 38.86. In June of 24, we reevaluated. And so came down a little bit on our disengagement, and our exhaustion also came down quite a bit. And so we were less exhausted. That showed up really well. And so that, brings us joy to see that you are less exhausted at work. You can see we're still at a high risk of burnout, but we came down by 3 points. So that was good. We are due to reevaluate it in the end of February. I would imagine it will look higher and not as well. And we can see that because of what's going on in our organization with our new tower, what's going on with our budgets, which are even tighter because of the new tower. And so that's hard, but we'll look at that again. And so we had that significant reduction in exhaustion, enhanced quality of life. Our leaders showed up rested and rejuvenated, and we had an increased leadership effectiveness. We also looked at our hospital-wide engagement survey. And so these results here, you can see our 2023 results, and the blue tells you what we came up on. So well-being, we increased, resources and support. The organization cares about my health and well-being, and the stress at my work is manageable. So we are making improvements and doing better. This will also be reevaluated in February. It opens up very shortly. And so we'll be able to look at that survey again. It's a hospital survey. So reflections and takeaways here. I love this quote. We must shift burnout from a me problem to a we problem. And this comes from the US Surgeon General. This is where I cite a lot of my information. And so looking at that, it is not a me problem that I am burnout. We are part of the problem that we are burnout, and we have to work together to fix it. So there's balance that prevents burnout. These are the 5 hats that business leaders must juggle. So spending time with your family, established friendships, creating business path, building connections and hobbies, interests, and adventure. And how do you balance all of this? Lessons learned here. So this has to be at the forefront of your mind. And we have so many things at the forefront of our minds. But if we don't pause and denormalize our level of burnout, we will never make changes to improve it. We need to pay attention to our emotions. So how do we show up at work? One of the leaders I very highly admire that mentors me, I never see you stressed. How are you doing that? He said, actually, with my teams, what he does is tells them, he actually puts, well, he used to use a smiley face on his door that showed where he was feeling. So like if he was in the orange or red, he's like, I am not okay to talk right now. Like, I'm actually not going to show up my best self. Oh, he's like, that's why I've canceled a meeting before with you. I wasn't going to show up rested for you or show up in the way you needed support. Okay, that's fair. So paying attention to your emotions is huge. I think our email group, you can evaluate at the end of every day how your emotion was that day. Your phones can do that too. You could do that with writing it down different ways. Shifting and reprioritizing is huge here. So reprioritize what what matters to you. Consider your alternatives. So what else can you do in lieu of what you are currently doing? Again, that's part of pausing and denormalizing, and then implement changes that will help you be successful. Our next steps up here. So we are going to reassess with our Oldenburg at the end of February. We will reassess with the hospital-wide engagement survey. We're going to evaluate current initiatives. We will sustain our initiatives with a positive impact. That's hopeful there. We will abandon well-being initiatives that are not value added. This is key here because as we evaluate what we're currently doing, if it's not working, don't use it. Don't do it. Let's fix it. If it's broken, then fix it. If it's not, let's keep going. Adopt new initiatives as identified. So maybe there's new literature out there. Maybe there's a new, anything that the team might identify as helping them. And then continually reassess and prioritize the well-being